Euthanasia is the idea that there are better and worse ways to die, so choose the better one. We refer to the mercy killing of animals as euthanasia. We have this idea that a death of some dignity might be possible. We have an idea that we should not have to go through all of the problems associated with end of life in our current era. We might even describe it as Nietzsche does in terms of taking charge of when you die. Not merely then in terms of suicide, as we talked about on the suicide video, but also for euthanasia, being able to say to someone, I am ready to go, send me off. Lots of people object, and we're going to look at a very important objection in this video, and we're going to look at something that isn't really so much an objection to euthanasia or even a defense of euthanasia as it is an explanation of why many people's understanding of euthanasia is just wrong. Standardly, we differentiate between voluntary euthanasia and involuntary euthanasia. Voluntary euthanasia is when the person who is to die chooses to die. Involuntary euthanasia is when somebody else chooses that they should die. Typically, when we use the term involuntary euthanasia, what we're thinking of is patients who are comatose and cannot choose for themselves and have someone else stand in for them. Or perhaps, if no one is available to actually make a decision on their behalf in terms of a family member or a legally appointed guardian, the decision is made by the physician or the medical staff. Anyway, it's when they don't choose as opposed to voluntary. It's when they do choose. There is also another division that's popular between active euthanasia and passive euthanasia. You're dying of a terminal disease. If we stop treatment, that is to say, we make no active attempt to make you die, but rather let the disease carry its course or other associated problems take over the situation, that's referred to as passive euthanasia. Active euthanasia is when someone takes an active exercise in making you die. Now, what most people, if they have any notion that euthanasia is good, what most people advocate for is active voluntary euthanasia. What we have very, very leery of is passive involuntary euthanasia, because passive involuntary euthanasia looks a lot like murder. I mean, without careful justification and careful defense, that's a real problem, passive euthanasia that's involuntary. Gay Williams, in the article, The Wrongfulness of Euthanasia, wants to argue that there is no such thing as passive euthanasia. Certainly no such thing as voluntary passive euthanasia, and it's very questionable whether there's such a thing as involuntary passive euthanasia. Gay Williams says that passive euthanasia is just rejecting treatment or refusing to give treatment, both of which are standard procedures without any reference to anything like euthanasia. My doctor can tell me to lose weight, I can ignore that. That's me doing nothing and choosing to do nothing. I can be told to take medication and refuse medication. That's me doing nothing and choosing to do nothing. My physician can offer all kinds of advice, direct me in all kinds of manners. I can reject any of them voluntarily and that way I am refusing treatment, and that is not, he says, euthanasia for other cases. Why on earth would you call it euthanasia only in the case of a terminal treatment, especially when you can never be sure that any particular case is entirely warranted to label as terminal? So that's voluntary passive euthanasia. Involuntary passive euthanasia, the refusal to treat, again, the physician is not compelled to treat. The physician offers advice, but that particular physician doesn't have to carry that advice out. I can suggest you need surgery, but I can refuse to do the surgery. I can suggest you should take this medication, but I refuse to write a prescription for that medication. Perfectly within my rights as a physician, all of that. If I'm talking about your blood pressure or your corns or your cancer. So these, he says, these don't count at all. Okay, Williams passes over the whole idea of passive euthanasia, saying there is no such thing. That's just either refusing to treat or refusing to be treated. So this is the creation of an artificial category when it comes to euthanasia. Now, we come to active euthanasia. Now, active euthanasia, Gay Williams rejects active euthanasia on some very concrete grounds. The first ground is what he calls the argument from nature. While there is some reference to natural processes here, I do think Gay Williams is talking here about the nature of the being, about essence, rather than, well, the old canard about lemmings plunging off of cliffs. I mean, we know they didn't actually do that. But if you did have an animal that naturally committed suicide, I don't think that would count against what Gay Williams is trying to say here. What Gay Williams is trying to say is that it is an essential component of being a living human being to want to live. And that when we agree to kill this person or allow this person to kill themselves or whatever form of active euthanasia we take, we are in fact violating the essence of what it is to be human. That being true, it is immoral. Just that easy. There is in the human organism, as part of its essential description, the desire to live. When I violate that natural essential characteristic, I am being immoral. And may even, almost certainly, in Gay Williams' opinion, be irrational. So that's argument number one. And Gay Williams says, that's enough. I don't need any more, but let me give you another one because I like you and I want you to have good reasons for not using euthanasia. He calls this the argument from self-interest. And that is, when we have euthanasia performed on us, I'm sorry, it just sounds like, well, when we have euthanasia performed on us, all hope is abandoned. If tomorrow our situation is suddenly curable, or even a week from now, or even 5 weeks from now, or even 5 months from now, if it is possible that I could have stayed alive and been cured, then accepting euthanasia as an option was against my self-interest. Now, I don't think that what Gay Williams is arguing for here is a form of egoism. I do think that, again, human nature is, with exceptions, I should always be interested in my own well-being. Being dead is never in my well-being. whether you are a religious person or you are not. Being dead is not being here. And you cannot have well-being here in life if you are not alive. Just that simple. Thus, when I stop looking out for my own well-being, I stop looking out for my own self-interest, I am being immoral. And euthanasia is me stopping that. Some will contend that perhaps my interest for others, I don't want to bankrupt the family with needless health care. If I've absolutely reduced myself to where I'm going to starve to death after I'm cured of my disease, that doesn't seem to be my self-interest either. But in terms of overall healthy well-being, in terms of the existence of the organism, to stop trying to be alive, to in fact have myself killed, seems a clear violation of self-interest. Lastly, there is the matter of practical effects. If we accept the idea that euthanasia, killing the patient, is an acceptable thing for physicians, nurses, other health caregivers to be involved in, then aren't we going to demoralize them? Aren't we going to lead to a more likely euthanized outcome? And doesn't it change the very essence of what it is to be healthcare? Isn't healthcare about keeping us well, keeping us alive? Killing you is not keeping you well, and it's not keeping you alive. It's just making you dead. These violations seem to Gay Williams to be just as important as the other two violations. You can see here we're basically making a natural law argument. That is to say, we're looking at the essences of things. We're saying because of their essential qualities, these are the ways we should behave. That then is our natural law, the law according to the essence of the thing. And euthanasia does not follow those essences. Thus, euthanasia is wrong. The American Medical Association has at some times distinguished between active and passive euthanasia and accepted the idea that passive euthanasia might be moral, but active euthanasia never is. James Rachels suggests that trying to distinguish between the two is wrong-headed, it fails, and therefore this whole doctrine of saying active is bad, passive is good, misses the point and is in error. For example, Rachels wants to ask the question, how is it morally preferable to let a patient starve to death or a patient suffer from severe intestinal blockage or go through some of the excruciating agonies associated with cancer, or even to medicate them to the point where they're not even conscious really? Why is that better than euthanizing them? I mean, the whole concept of mercy killing again. We have an animal who's severely injured. Yes, they may recover to the point where they can be alive, but never recover to the point where they can carry out the function that they're used to carrying out, the essential nature of what it is to be that animal, a hunting dog, a racing horse, and we look at them and we go, well, they'll never be themselves again. We look at an elephant, will never be able to get up, walk around, and feed itself at the level that elephants have to be able to do in the wild. We say of these conditions, it is better to kill the animal, the mercy killing. Why then is it not better to kill a human being? Is a human being suffering so much less than that of animals? Well, we tend to think exactly the opposite. Is a human being that much less needful of our help? Again, just as needful, if not more so. So, and when we distinguish between active and passive euthanasia, and we label one as acceptable and the other as not, we certainly aren't doing so on the grounds of keeping them from suffering. We're doing so for some reason that we seem to think there's a difference between the kind of behavior involved. There are also occasions where the patient may die of one of two things. And we can treat one in order to help the patient live, but then they'll die of the other. And Rachel suggests, why treat them of either one? Why not go ahead and actively reduce their suffering in their life? He gives the example of a baby born with Down syndrome. Now, Down syndrome is not, in the strictest of senses, a terminal condition. Persons with Down syndrome don't generally live as long as the community at large, but it's not typically something you die from in a matter of weeks or months. However, it is often the case that persons with Down syndrome have other disorders, malconstructions, that need to be corrected by surgery. And it's suggested, why not fail to perform these reconstructive surgeries, especially since quite often when they're involved with the heart, particularly, the reconstructed surgery really doesn't do anything to improve the life, and quite often is just postponing an inevitable death. Why not? The physicians involved will say, I don't want to treat them. There's no point. It's not going to help anything. Let's let that go. And the courts say, sure, go right ahead. I understand your judgment. You're the pro. But why then let the child suffer? Why not euthanize the child? That's Rachel's point. Again, we're not reducing suffering. We're not improving life. We're not lengthening life by failing to treat. We're just guaranteeing pain. Again, everything seems to turn on the difference between actively killing and permitting to die. And now we come to my favorite part of the article, where we're going to kill the 6-year-old boy. There are two homes, one sitting next to the other. Wealthy homes, fabulously wealthy estates. At one lived the Smith family, and at the other lives the Jones family. Each case, the inheritor of the fortune, the person who is the current owner of all the wealth associated with these estates, is a 6-year-old child. Now, Smith plans one evening, while the small child is in the tub, to go in, push their head under the water, and hold them there until they drown. And they do so. No, that is, Smith does so. Yes, the boy drowns. Yes, it takes two to do this. But Smith drowns the cousin. On the other hand, we have Jones. Now, Jones decides to do exactly the same as Smith did. However, when Jones comes into the bathroom, about to drown the cousin, he finds the cousin already drowning. After all, a child can drown in as little as 2 inches of water. So a whole tub, it can easily be managed entirely by accident. So Jones Jr., Jones the cousin, has slipped under the water and is drowning. Glug, glug, glug. Jones the adult, the would-be heir to the fortune, stands by and does nothing. Now, no one, I think, has any trouble condemning Smith, who has consciously, physically, violently held the 6-year-old cousin underwater until they drown. Well, maybe you do. Maybe you don't like 6-year-olds. But other than that, I don't think we have any difficulty going, Smith has done wrong. Well, hasn't Jones done wrong? I mean, do any of us think that, well, okay, yeah, you just drowned there, kid, is an okay approach to the whole thing? I mean, yes, Jones went in there to kill him. Jones is a bad person. We know that. But is he any the worse, or no. Is he any the better for having allowed the child to drown on their own, as opposed to actually having done the deed himself? I don't see how. I think that a death which you can prevent, that you let happen, I think a death that you let happen is just as bad as doing the deed yourself. At least that's what Rachel's proposes, that there really isn't any important difference between the two positions, and as a result, the distinction between active and passive is wrong. Yes, it could be said, well, the child wouldn't die perhaps if Jones stepped in and pulled them out of the water. It is also the case that if I just stand by, that patient, suffering, agonizing, may live for weeks, months even, but they will die. They have a terminal illness. Right, the child doesn't, except in terms of their drowning. But there's nothing I can actually do to prevent the death of this terminally ill person. So why not? Instead of letting them suffer and kick and drown, hold them under and let them kick and drown. No, that's not my point. My point is, why not eliminate the suffering? Why not move right straight through and relieve the pain and agony of death? Now, in general, when persons advocate for euthanasia, they will advocate for some kind of psychiatric evaluation. We want to be sure that the patient is not reacting in an inappropriate manner, that they are adequately and accurately assessing the outcome of their treatment or lack thereof. So if they choose something, we must know that they are sane. As we've seen for Gay Williams, there is no way that you can choose to be dead and not be insane. You have violated the essence of what it is to be human. That isn't sane. Rachel says, I don't care, one way or the other, about your sanity, because making an active choice or a passive choice doesn't matter. So that if you are in fact wrong, so to speak, in your assessment of your situation, but it is terminal. Now that everyone agrees, again, who's in favor of euthanasia, because after all, if you're not dying, that's not euthanasia, that's suicide. See that video. If you're ill, it's terminal. As far as we can tell, there's nothing to do. Then we can call it euthanasia. You are dying and we're trying to give you a good death rather than a bad death. Oh, death with dignity. I once had a student say, nobody dies with dignity. There's all sorts of physical things that go on and leave you in an undignified state, regardless how you have died. Misses the point. The dignity here is not the dignity of your physical self, but rather the dignity of your moral self. Are we respecting your rights? I mean, that's the heart of, Kantian morality, respect of the autonomous individual. If we grant that autonomous individual their choices, then we are giving them dignity, or respecting their dignity. We're letting them act with dignity, and that's what we mean by death with dignity. A lot to think about, a lot to talk about. Keep on talking philosophy.